Hello, everyone, and welcome to another edition of the BuzzStream podcast. I'm your host, Vince Nero, and today I'm thrilled to be joined by Irina Karelina. She is the founder of Fungi PR. It's a boutique agency that focuses on health and wellness. But what's interesting to me, I think, in this conversation that we're going to have is Irina's been in this space for, around 10 years. She's mainly been working on apps in the health and wellness space, but particularly what we're going to be talking about today is kind of that sensitive area, right? So she's worked in industries have to do with sex education, hormones, women's health, infertility, infant health, like these things that are potentially harder to get coverage for. So that is what I wanted to introduce and talk about with Irina today, because I think there's a lot for us to learn here, because as you know, it's sensitive topics are typically pretty tough. So that's what we're going to get into. Before we do, I just want to remind people to like, subscribe, share this stuff with your colleagues. The more that you do, the more I can have great guests on like Irina. And secondly, I just want to remind people too that List IQ is out, our media list building tool. It's AI powered, but it helps you build lists and gather information directly from Google News. All this stuff that typically takes a good 10, 15 minutes to gather per journalist, you can get at a fraction of the time. So check it out, get some free credits when you sign up, and it's getting some great feedback from a lot of the PR professionals who have checked it out. All right, with that out of the way, here's our episode. How you doing, Irina? Thanks so much for joining us.
Thanks for having me, Vince. Yeah, I'm doing good. Actually, it's a great sunny day in Charlotte.
Yeah, that's what I was just going to ask. So you are, I take it, not from Charlotte originally.
Of course, I'm not. Yeah, I'm originally from Belarus. It's an Eastern European country, and I moved to the US 6 years ago. I moved to Boston, and I lived there for 5 years. And then after moving to Charlotte, I started my own agency. I mean, I've been doing like PR as a freelancer for 5 years almost, but then I started my agency officially, Fungi PR.
Yeah. Fantastic. I worked at an agency called the Grit Group, which is out in Charlotte. A lot of ex-Red Ventures. I don't know if Red Ventures, I'm sure, is very big out there, North
Hmm.
Carolina. But yeah, that's my only connection. I've only been there once. But we're not talking about Charlotte today. We are talking all about kind of more of this mission-driven, these industries that are sensitive and sometimes tough to get coverage for. So let's start here. I specifically didn't mention any of these in the intro, but you worked at, sites like Mira, which is a hormone tracking app, Tiny Health, which is a gut testing for infants, Harna, which is a cycle-based fitness app. Can you give us some other examples? I know you've worked on a bunch, so just give people kind of a sense of what we're talking about.
Yeah, so my agency specializes on health and wellness clients, like projects. And this is the topic that I'm really interested in by myself. That's why I started working with these clients. I'm millennial, so I'm very like wellness savvy, and I'm always looking for the ways to, improve my health in a way. So my first client as a PR freelancer was Mira, which is home hormone tracker. And it was, and it is like still my client, a very sensitive theme and topic, because this hormone tracker is helping women to conceive, but not only women, but also, transgenders or, same-sex couples. And they actually launched during pandemic, and this tool was really helpful in continuing like fertility treatments at home while all the fertility clinics were closed. So this is like our like main, I would say, client in the agency, but also I've been working with such topics as infant health, menopause, period health, DNA testing for pets, sustainability. So all of these topics also kind of, mission driven, scientific, complex, and hard to reach.
Yeah. And so you mentioned kind of three things there, scientific, complex, hard to reach. What about that, though, makes it tough? I mean, when I think of a complex topic, like there are plenty of big agencies and like pharmaceutical, that's one. I feel like that they put tons and millions and millions of dollars into advertising, and they always kind of try to figure out ways to get the stuff out to market. But as a PR agency, it's a little different, right? Like you don't typically have the same amount of money, and there's probably a lot more limitations on what you can do because of like regulations and whatnot. So can you speak a little bit more just specifically about what you think makes it more difficult?
Yeah, so it was like really surprising for me when, I first got these clients that this is like such an important topic. This is, like such an issue. Why journalists like didn't pick it up immediately? Like why they don't talk about it? And what I figured out, in my experience, is that they don't just journalists and media, don't look for covering the problem that existed for years. They're looking for changes or some trends or some dynamic in society. So, just having a client that, for example, I don't know, solves the issue of like women's health ignorance that was, going on for years is not enough. Like you need to add news hooks, you need to frame it strategically, you need to like make it trendy and so on. So what makes them specifically harder is that they're like evergreen. They kind of existed for years. So sometimes they lack surprising data. They don't have like this moving media entry point, as for example, dating apps have, like just naturally you can find a insight, like data insight, and pitch it to journalists and make it really like stand out. Because mission driven topics are usually also like emotionally sensitive. It's not possible to joke around, right? So you need to be really careful with what you pitch and how you frame it. So yeah, I would say that these are a few features that make them really hard to reach.
Yeah, I mean, it's interesting you say those two. Like when I talk about, we did this big study on, the survey site YouGov, right? They produce, hundreds of surveys a day, I feel like, and they publish a lot of them. And we analyzed, I think it was like 2,500 of their top pieces of content that they've published, their top surveys. And the thing I kept coming back to was this idea that, especially surveys, had some type of timeliness and some type of emotional connection, right? They elicited some type of emotion. And usually it was like hate or fear or doubt or, that sort of thing. And, you're saying to me those two kind of hooks are probably some of the harder things to do, especially timeliness if they don't have great angles, if they're kind of limited on what they can attach to, it's I can see how that can be difficult. But let's kind of flip it here. I want to give users a chance to kind of frame how this actually does work, though. So I'm curious if you know of any brands out there that are doing this well, and feel free to talk about some of your own brands and how you have done this and succeeded.
Sure. Yeah, I really like how modern like women's health companies are doing PR around such stigmatized and sensitive topics as infertility or miscarriage or menopause or like postpartum depression. For example, there is a employee benefits company, Carrot Fertility, which turned menopause into workplace issue. So instead of just, pitching like or saying that menopause is a personal health issue, they found out that menopause productivity loss costs U.S. economy almost $2 billion per year. And they started to pitch it ahead of Menopause Awareness Month in October, which we also have done with my clients. So we were kind of competing for media coverage at the same time, pitching same angle. But it was great example of, tuning into bigger context, bigger problem. Like, see, this is not some women's issue. It's the economical impact, its impact on the workplace because women are leaving workplace early. They taking days off because they cannot like handle symptoms. So you need to do something about it. Or, for example, I loved how Evvy, it's a vaginal microbiome company, turned women's health research and lack of women's health research into movement by establishing Equal Research Day on June 10th. So they
Oh,
picked
that's
a
cool.
date when women were included into medical research, and they pitched it as a concept to journalists that, see, we want to celebrate this day to make it Equal Research Day for both men and women, because for many, many years, men were tested, like all the drugs were tested on men instead of, women, because there was a misconception that hormones are messing up with the
Hmm.
results, with the test results. So it was a great example. And they also, partnered with other brands. So instead of just saying, see, like women's health being like ignored for years, they created this like specific day, specific campaign. And it was like much easier for journalists to pick it up. So with Mira, we've done something similar. Actually, we wanted to, so our like initial goal as a PR agency was to move out from fertility topic to overall like women's health topic, because everyone perceived Mira as a fertility tracker, and we wanted to change that. So we knew, we knew that there is a lack of understanding of hormones in the society, but we didn't have specific numbers. So we did a survey, and we found out that like 90% of Americans feel unprepared for hormonal changes. So the sex education isn't working in the US, and this number was like so huge that we went ahead and pitched it. As a hook, we created a sex hormones tester. So we asked people to apply for sex hormones tester, and we said that we're gonna pay $5,000 for testing their hormones with Mira. So again, emphasizing that this topic is so important and people don't know about their hormones, that we're going to pay them for, testing their hormones with Mira. And it also like had great success with media, because it was like basically PR stunt, but in a good way. And then we created Sex Hormones Awareness Week as a third, phase of campaign. We created the Sex Hormones Awareness Week in as a last week of February. We also partnered with many brands. We held an event in San Francisco. This campaign was so complex, and it was about this huge, huge knowledge gap that people actually like don't understand the hormones, but we didn't push the product forward. We
Mhm.
pushed the problem, and the product was just part of the story. Yeah. So yeah, with this campaign, we got like over 1 billion views, media reach, and 6 awards, and a lot of traffic to the website. So this is one of the campaigns I'm like really proud of.
Yeah, that sounds fantastic. I was jotting down some notes, kind of thinking through this like from a tactical level. It sounds like there's maybe this idea of creating awareness days, right? Creating campaigns around, your self-made days, right? It's not just an existing mental health awareness week or something. It's you're going to kind of create your own buzz. I love the idea of like the tester, the hormone tester. I feel like that seems like very much a UK thing, that tactic. I don't see it played out as much here in the States, but I feel like it's, I feel like I put that in the same bucket as like the dream job type
Yeah.
tactic. And then obviously like there's the survey thing. So the data that you can get from a survey, and it sounds like you and these other companies that have done it well have kind of leaned into the unexpected, or these like friction points, these like misunderstandings and problem areas, like as you said, which to me, I mean, I think checks that box of like this elicits some type of emotion. Maybe it's not fear, or maybe it's not a surprise, but it is, you're filling that knowledge gap or curiosity gap, I think is kind of how you put it. So I love that. I'm curious. So you've mentioned a handful of things too. Like, do all of your campaigns touch different segments? Am I putting it? It's like, do you publish them all on social media as well as press releases, as well as pitching to journalists, or is it depends on the different campaigns?
No, it's really depends because like this campaign was really like 360 campaign, so
Hmm. Hmm.
involved, like influencer team was involved, like social media team. What our agency does is media relations mostly. So yes, of course, like a lot of our campaigns are not intersecting with marketing.
Social and yeah, yeah. Okay, interesting.
Yeah, some of them are like really quick. For example, like when after COVID, this like COVID vaccine appeared, and many women felt that this vaccine is messing up with their hormones. So we did a quick survey of our customers, like if they experienced something like this, and pitched it immediately. Or for example, right now with like GPL drugs, many
Right.
who are taking Ozempic say that it improves fertility or otherwise. So we also ask our users, and we're pitching this right now. It's like our current campaign, because like we're trying to, like tune into momentum of what people are talking about, what are like they concerned about. The difficult the difficulty here is that we need to be careful with privacy concerns, with privacy issues. Because we cannot just say we looked into our users' data and we're pushing, even if it's
Yeah.
it could cause backlash. So we need to be like really careful with that.
Yeah, it's interesting. So talk about kind of like reframing some of this data. I mean, the data itself, like privacy concerns, obviously that probably cuts out a lot of this proprietary data, but the idea of like getting third party data to be able to use, you mentioned this idea of like these insights that lead you to then do these surveys, like this idea that, GLP-1, some people felt that GLP-1 or the COVID vaccine was influencing hormones. Where do you find trends to kind of hook on to like that?
It's just, I call it social listening. So it's just scrolling through Instagram or just media monitoring, which every PR manager does. Or even like talking with my friends who are, you know, trying to conceive or having kids or have experienced any other problems like with hormonal health. I mean, and many of the ideas actually come from my own experience. So, yeah, for example, it's not from my own experience, obviously, but for example, right now we are working with a really cool company that launched functional drinks for hormonal health support. And they are going to Sprouts. So kind of we could have, started with pitching the product. Oh, this like cool functional drink. Like, do you want to try it? But thinking about like what's happening behind this launch, like, that women's health is actually going mainstream. Some of the brands, I live near Sprout. I can go to Sprout. I can buy some kind of like drink for period pain or like menopause or like whatever. This is so cool because all these topics were stigmatized for years, but right now they are on the grocery aisles.
Yeah.
But this is kind of something that also I can, feel as a consumer, as like potential consumer of these brands.
Yeah. I mean, I think the tough part for people that I speak to in these industries who aren't PR, they don't have a PR team, but they're trying to do this on their own is like, when you talk about social listening, it's easy to say, yeah, you just listen and find some trends, but like to have the brain like you do to be able to connect the dots where it's like, this is a newsworthy thing, this is how I'm going to hook it into my brand. Can you talk a little bit about, are there specific questions kind of that you ask yourself as you see these trends to try to understand like how you can fit your brand into that?
Yeah, I would say it's like the most common mistake I see even in my own like managers in my own team, because they are trying to find a news hook or angle for a journalist. They think about a journalist first. They're like, okay, I gotta like research his articles or her articles. I gotta see what she's writing about. But what I suggest doing is always think about like the target audience, like the final audience. This is just a medium. It's just a tool. But what they're looking for is to explain some complex things or some trends to their consumers. So eventually, uh, I am a target audience of my own. clients, So you just need to tweak your brain and, think what you personally would read, what you personally would be interested in. Not about like what campaigns should I create so journalists pick it up.
Right. Yeah, that is really interesting. I love that thought process because a lot of times we do stress a lot, with BuzzStream. It's like, and I talk about this all the time on the podcast about, finding journalists and understanding what they write about and, what the publication writes about and then looking at the recent articles. But, if the story that you have is not compelling, it doesn't matter, any of that stuff. Right. So like, I think a lot of our guests agree this idea of like story comes first, no matter what. So it sounds like, not try not to get lost within the nuances when you're digging into a story. I love that. So I had a question that I was going to ask about kind of common mistakes that people make in this industry. I mean, that sounds like maybe more general mistake that PRs make, probably. But what are some common mistakes you've seen people do where this can fail? I mean, obviously, this is a sensitive area. Talk to us about that.
Yeah. So honestly, I've done these mistakes by myself, so I can speak from. Yeah, I was, even when you research for, like, first of all, it's trying to pitch importance to trying to pitch the problem itself. This is something like evergreen, you know, issue without tying it into current events, tying it into some trend or useful or policy shift or cultural movement or whatever. So even if you have some data insights, let's say you have budget for running a survey, you may ask some evergreen questions, like, for example, do you know what hormones is, or do you know what gut health is? Like, do you experience this or do you experience that? And journalists won't like write it because it's too kind of obvious and too
Mm,
evergreen. So what you need to do, like even when you're like looking for this data, is, as I said, to first of all listen and find the topics people are really like eager to know about, or they're like talking about it right now. For example, like one of the recent examples, there was a storm, there was a snowstorm in some of the southern states, and we've been working with this like stress management app. So everybody knows that people experience stress and a lot of it. And we assumed that during ice storms, people also experience stress and even in higher levels. But what we found out is that actually during this ice storm weekend, there was the lowest stress levels through the entire year. So this type of insights, yeah, something like very surprising, counterintuitive, you can use for, pitching your client. But for example, if let's say we find out that people were stressed, very stressed during this weekend, it would be interesting at all. How would you pick it up? Because of course, it's kind of obvious that people struggle with infertility. It's kind of obvious that people, you know, want their kids to be healthy. But finding this like counterintuitive insight is like the key. So yeah, I would say that going mainstream is not mainstream, but like super like generic. Also, if like you don't have clear angle, it's the biggest mistake. Even when you have like a scientific paper, let's say your
mm,
client published
mhm.
scientific paper, but you don't have this, understanding what the story behind it. It would be tricky because I have a study is not news. No, it's not a book. Then what else? Yeah, let me
What
think.
what what about
Yeah.
like I feel like there's this idea of when I like hitting a sensitive topic to kind of head on,
Mm.
like I feel like there's sometimes the need, if there's something that's really, talk about infant mortality or something, or infant health. It's like some of these things can be so, even if they are timely, it's a big data piece that's surprising or something, but like it can just be too heavy almost. I mean, do you run into those types of challenges ever?
So one of the examples I can recall was again with Mira, because sorry, we've been working 5 years, so this is always
Yeah, hey, it's all right.
that one of the transgender couples got pregnant with Mira, and we could have gone wild with this headline, like a man got pregnant using at-home fertility tracker, but we intentionally tweaked the conversation around the challenges they had while trying to receive fertility care in traditional healthcare
Mm,
system. So, of course, these like sensitive topics require very sensitive approach, because you can abuse someone just by creating this like yellowish headline, like you need to think
yeah.
twice. Also, of course, like with infant mortality, we worked with this gut health testing company, and there was a huge number, like 70 or 80% of children have chronic condition, at least one chronic condition by age like 5. And we were trying not to capitalize on this number, but instead like telling real stories. So real
Hmm.
stories of their customers who, for example, got gaslighted by medical system, turned to this at-home health testing company and figured out what's going on with their baby, like why the allergies, why the asthma, why the like diarrhea or something like that. So I would say that like using real voices, experts, like data helps to make the story clear, not loud.
Yes, clear, not loud. Yeah, I like that kind of hint of what the yellow journalism thing. It's like you don't want to exploit people. I mean, it gets back to the privacy piece of it for sure. It's like there are probably plenty of stories out there of individuals who are, but it's a fine line between, do they want to be out there and I mean, I guess could you talk a little bit about that? Because I'm sure, one of the things we get told a lot from journalists lately is that there is a need to kind of provide these kind of like case studies and like live examples and like real people to present experts and sources for this information that they're seeking, these stories to kind of build out the stories some more. But if, you don't want to put someone on blast for something like this, right? Like I'm sure in the medical profession, there's a lot of people who are hesitant to be a source and put a face to the name. Can you talk a little bit about those challenges or about, how you get around that?
I mean, if the product was really helpful for consumer, they will most likely agree to, talk to
Mm,
journalists. Some of them prefer to stay anonymous, but these stories are harder to pitch. I would be like honest with you, because journalists want names. They want like real people behind the story, not some example like user case. But like in my experience, even having a strong human story doesn't necessarily automatically mean that you will get this like tier one coverage. So it
hmm
still needs to be a compelling story. It needs to be an angle. And yeah, I had multiple campaigns with like super active users that are like super ready to talk to journalists, but I didn't hear from them because there was some basic, maybe like not basic, but these like women got pregnant with like this device. So if you make it promotional, it won't land.
Is the expert, so you mentioned like, if people have good experiences, they are, potentially more likely to provide commentary. Is that
Mhm.
something you bake into the app? I guess that's one question, but then like for you as a freelancer PR working for these apps, is that something that you have to solicit from the company that you're working for?
Yeah, so we need to talk to the marketing team and ask them for the contacts of the people because we don't have direct access to them. So it's also, some of the most important moments in working with such brands is like this communication between PR team and marketing team. Because sometimes they have like crazy things going on, like super interesting, but nobody to tell us. So we need to
Yes.
stay tight and communicate like tightly about all the user cases and news and what they're doing so that we can, like jump on this quickly.
Yeah, I mean, do you have any tips for people out there? I feel like it's a good place to wrap up of just like tips on how to facilitate and make sure that those lines of communication stay open and, for especially for those who might be hesitant to spend their time helping out a freelancer. I can feel like sometimes there's that demarcation line where it's like, well, that's their problem. I'm the marketing team. I'm doing this stuff.
You mean like how to extract those like this information from.
Yeah, yeah, and maybe right, how to bridge that gap if there is a gap, especially as a freelancer.
Mm.
Or do you find that people are open to sharing? I mean, have you not run into those challenges?
Like, you mean the, like, internal team of the client?
Yeah.
Yeah?
Yeah.
I mean, I think it's as a PR agency founder, I can say that like 50% of our work is to educate like client and talk to them. So, of course, if you like come to the call to the sync asking them revenue numbers, personal stories. I don't know, something else like without explaining why, you can face like backlash or resistance. But if you communicate, if you explain like why it's important, why we need the story, why we cannot just, put your product on the Forbes cover or like New York Times. I think the like it's just, basic communication skills, I guess. But you also need to be like empathetic to their customer challenges. You need to show that you are not going to exploit their customers. That you have to be gentle. You have to be like really careful communicating with them. So yeah, I think it's just like winning this trust over time, showing your empathy to the client and your
Yeah.
professional, of course.
Yeah, and maybe like you said, kind of not asking for everything in the kitchen sink right off the bat and building that trust. I love that. That's a great message. Arena, is there something that, maybe we didn't cover in the podcast that you think readers or listeners should know all around this topic?
Well, I think that it's pretty much it. However, if, to summarize all that being said, I would say that the most important is like three takeaways. First, that just the problem, even if it's important, is not interesting for journalists. Like you need to frame it, you need to find a news hook or make it timely. And second, that product PR is not enough. Like even having a great product, if you start like pitching your product, it would be challenging. So you need to find the context, bigger, like some bigger problem, and then tie your product as a solution, as a part of the story, not like put it in the center of your pitch. And the third one, I would say that you need to be really like without simplifying complex and scientific topics, you need to be really clear and talk with journalists in a consumer's language, without overcomplicating things. Because that journalists don't bite if they don't understand. So just think as a consumer, think as an audience, and it will help you to, craft your message clearly.
Yes, I love that. Well, let's leave it there. I want to give people a chance to connect with Arena. Is LinkedIn the best place to find you?
Yeah, yeah, it would be the best place to chat.
Awesome. Well, so if people have questions about any of this stuff, obviously like subscribe, but engaging with this through comments is also a great way to ask questions. And, you can do it on LinkedIn, on my posts, if Arena posts about it. But, I will make sure Arena answers those questions if you have any specifically about your brand or any of the problems running into doing PR in these sensitive, tough industries. So, Arena Karelina, I really want to thank you so much for joining us. Yeah,
Thank
sorry,
you so
let me
much.
redo that. Redo that again.
Thank you for your
So again,
thoughtful questions. It was like really, really interesting conversation with someone who is, like not inside of this like mission-driven industries. Like your questions were really sharp.
awesome. Well, thank you so much for joining. I mean, I feel like you're doing some amazing work, and this is an area that's very important. So, the more people we can educate in this space, I think the better. Again, it's Irina Karelina, the founder of Fungi PR, and I will link to all the stuff that we talked about today in the show notes. I want to thank you all for watching. Stay tuned for the next one. Thanks for watching.
Thank you.